The trapezius is one of the major muscles of the back and is responsible for moving, rotating, and stabilizing the scapula, or shoulder blade, and extending the head at the neck. It is a wide, flat, superficial muscle that covers most of the upper back and the posterior of the neck. Like most other muscles, there are two trapezius muscles, a left and right trapezius, that are symmetrical and meet at the vertebral column. The trapezius can be divided into three bands of muscle fibers that have distinct structures and functions within the muscle. The superior fibers cover the posterior and lateral sides of the neck with their tendons, connecting to origins along the occipital bone and insertions on the clavicle. Just below this region is the narrow band of the middle fibers, which extend from origins along the superior thoracic vertebrae and insert at the acromion process of the scapula. Finally, the inferior fibers cover a wide region of the back from their origins along the inferior thoracic vertebrae and insert into the spine of the scapula. Because the trapezius muscle works and moves the neck in several directions, its degree of tightness or looseness affects the neck's flexibility. For people who work at desks and computers or have spending many hours driving, the upper trapezius is a muscle on top of your shoulder that becomes very sore and painful. The trapezius is an accessory breathing muscle. This means that it helps you open up a small amount of breathing room in the upper chest area. For back and neck pain management, it is best not to rely on the trapezius alone, as this will produce shallow breathing. The most primary and powerful breathing muscle is the diaphragm, also muscle of posture, affects a large volume of breathing space all the way up and down the torso. Trapezius pain is a classic stress pain. Your shoulders ache, your neck hurts, and it's often deep and achy. You may have headaches, especially in the temples or behind your eyes at the base of your skull. You may also feel burning between your shoulder blades after sitting at your computer without elbow support. Things that can cause trapezius pain, and foremost, are stress, heavy purses or backpacks, sleeping on your stomach or your back, bending forward for long periods of time, too high of a keyboard, and whiplash, just to name a few. Although the trapezius muscles tend to get very tight for most people, they respond very well to massage. An added perk to that is that they are located in such an area that you can reach them on your own. Try doing self-massage of your trapezius muscles till you can meet with your massage therapist to set up a treatment plan and preventative maintenance.